Reports have been circulating that the University Hospital of the West Indies has reached its bed capacity due to the increased numbers of COVID-19 cases. This and other issues related to the hospital were addressed by Medical Chief of Staff at the hospital, Dr. Carl Bruce. Melvin Pennant has that report.
Dr. Bruce gave an update on the number of COVID patients currently at the hospital.
As of today, we have 23 active cases at the university. 4 of those patients are critical, and one patient is intubated. But we also, as you know, test the patients who we admit as emergencies at the university, and that testing will yield, even though the doctors will go ahead and treat our emergency cases, the tests will sometime return positive, and so from time to time you will have cases that are not on the COVID ward that's picked up by our screening tool. And so this evening we have 3 patients on the surgical wards that we are waiting to be transferred to the COVID area. We also have 2 patients in the emergency room who have tested positive and who will be admitted. As was outlined before, we are admitting to hospital only those cases which are serious, obviously moderate or severe cases, but cases that our specialists deem need to be in hospital, whether it be for supplemental oxygen and management, physiotherapy, etc.
Dr. Bruce also addressed a recent letter that was circulated by a group of doctors at the hospital, expressing concern about the capacity to deal with the surge.
The letter from our doctors, and you know, whenever the clinicians at the university speak, we really listen to them. We're very empathetic to them, and we take them seriously. And you know, I must say that we are humbled by their courage. We have been inspired by their compassion, and we are grateful for the service that they have given not only to the university but to the Jamaican public. In the initial part of the pandemic, about 8 of our healthcare workers would have tested positive. Since the surge has occurred, or the increased number of cases, we have had about 9 of our doctors test positive. We expect this number, unfortunately, to increase. As we said, we don't deny care to our patients, and therefore, when we admit the emergencies, even though we are going to take care to ensure that all possible precautions are taken, and that we test them as best as we possibly can. That delay between testing, getting back the result, and the doctors treating or doing emergency surgery is going to result in a period of exposure that we cannot control. And so as the number of cases increase, we would expect that more of our healthcare workers are going to be affected. We have met with the residents, and we have met with the heads of department, the CEO, the head of HR, the legal officer, and the residents themselves, and the head of department, Professor Boyne. And as the number of cases increase, we know that we have to reinforce these teams, and we have that plan that's there to reinforce the team. And we, in some instances, will have to ask the other specialties to help with their patients as we go forward.
Dr. Bruce said that the hospital will also be activating areas that have already been retrofitted to care for COVID-19 patients. Melvin Pennant, PBCJ News.